Hey guys, Chantel here. So I wanted to talk to you a little about drains. I know a lot of people get very intimidated by these drains, including me when I went home with them for the first time. So this is now my third time with these babies, and so I thought I would just take a minute to kind of share a little like how-to and little tips and things that I've learned along the way. So these are the JP drains. You get them after having like a mastectomy, single, bilateral, or even reconstruction. So in this case, I just did an exchange surgery, and so my surgeon chose to put in drains. Some surgeons don't, so it just kind of depends for reconstruction. So as you can see, they've got some stuff in here. You can kind of look at the color, like you can see this one's a little more amber color, this one's a little more red. Gotta tell you, I'm not sure why this one's so red this morning because it wasn't yesterday, so I'm not sure if I should be concerned about that. But so these are the little drain thingies. This particular pair came with these little clips that is kind of cool because it can just kind of clip right onto your compression bra, or I could flip this around and put it on my pants. The other thing that they all have, and I will show you this, is they all have this little loop right here. I don't know if you can see, but there is a loop that this little thing's going through. So you could basically run that on like a belt, which is what I've done before. And it actually comes in real handy if you're going to take a shower of any sort. They don't want you to get the bandages underneath wet. But you can, usually your doctor will say if you can take a shower or not, and if you can, it would be without getting your bandages wet. But it makes it really helpful that you could run any kind of little belt through here. I've actually used like a stretchy physical therapy, like the little rubber stretchy bands that I would run through, wrap it around my waist, and just tie it while I was in the shower. But today I'm going to talk to you a little about draining these bulbs. So what I'm going to do is actually just clip that onto my pants here so it hangs a little lower. And you want to milk the tube or strip the tube, depending on how they've explained it to you. So the first thing I'm going to do is this is coming out of my body up here. This is all taped down because he doesn't want this to pull. He doesn't want me to pull and pull this thing out because you can't. You don't want to do that. So what we're going to do is down here, you probably can't see it, but this is where the clear tape ends. So I'm going to grab really firmly and just hold it very snug to my body. With this hand, I'm going to take my finger and thumb and pinch, and then I'm going to squeeze and pull it all the way down. This is a really stretchy band, but see how my left hand is stationary and holding. So then you just kind of move that grip and continue working down the little tube. And I don't know if you can see this, but I'm actually draining. All this stuff is going into the little bulb. And again, I have no idea why I have so much today and why it's so red again, but we'll deal with that later. But anyway, so you want to do this a couple of times. The other thing is that this particular tube, the tubing right here, you're going to drain the same way. This one is actually what they call a micro tube. It's a little bit smaller in diameter, which is really nice, gotta say, because it actually, it's less uncomfortable coming out where it comes out of my body right here. It's less uncomfortable than the larger tube. If you have the larger tube, which is what I've had before, 2 times before, those are a little bit more uncomfortable. But anyway, so we've stripped this tube. We would then come over here and do the same thing for this one. So, I mean, I could leave it attached to my bra up here, or I could bring it down low. Of course, gravity kind of helps, but I've been doing it the last couple of days, just leaving it right here. So, once you do this and you kind of strip it into the bulb, then you're going to dump the contents of this into a little measuring cup, and we'll get to that part in just a second. Okay, so one more thing I'm going to show you before I move on to emptying the bulb is they're going to tell you to use a like a little alcohol swab to do the stripping. And I will say that it works very smoothly, just to make sure that you're not, I don't know, like getting your fingers stuck on the sticky tube that this keeps it moving smoothly. So a little wet alcohol swab is all I'm using. So what I do is I use one for the outside and then one to clean the tip of the bulb. So you'll want two of these little things. And as you saw, like you can strip it without using this, but they like you to use it for that reason that I just explained, so it doesn't get stuck. And that could result in like you accidentally like pulling the tubing more than you plan to. So even though like I keep stripping the tube and there's still stuff in there, sometimes it's a little better, like it ends up a little bit clearer than others. But it's okay to strip it several times and just get as much as you can down there. And then the other thing I've learned is sometimes you get little, and it sounds really gross, but you'll get little clumpy stuff that gets stuck in the tubing or in the little neck that filters into the bulb. And flicking the little part there can help sort of move if there's like a little clot or like a little clumpy something stuck there. You can usually help to move it down. So that's what we've done with that. I'm going to use this one since it's so colorful and kind of easy. Normally what they'll do at the hospital before you leave, they're going to give you these little clear measuring cups. And the measuring cups have all like little lines, so measurement lines, so you can tell like how much your output is. And well, this time around, they actually forgot to give me the little cups. So you just like we do. So my husband cut a little cup, and then we're using a little syringe to kind of suck it back in so we can see like how much is coming out. But so what you'll do is there is like a little tip to this. Hopefully you can kind of see. And so I actually will get a clean, because the inside of this you really want to keep pretty clean because, you know, ultimately it does have a direct connection to your body. So like what's coming out of this tube is directly coming out of your body. And so you figure if you put any bacteria into this little thing, it could, you know, that does have a direct link to your body. So you don't want any bacteria. And before I started all of this, you guys, I washed my hands. So that's important to know too. So I flipped the little thing up. So I usually use my sort of dirty one to flip it up. And you'll hear the air as it comes in, and see how it just like fills up with air completely. And then it's kind of like a little awkward thing to finagle getting the nozzle into your cup without pouring your contents all over the little tubing or this little cap. So you just kind of have to finagle that a little bit. And I usually try to use the side of my cup to kind of keep the tip there. Try to get the hose out of there. It's just, you know, it's not perfect. So, and then you just kind of pour the contents in. It's very bloody today. I'm mildly concerned. That is quite red. So you're not going to get every last drop out of here. Just tell you that right now, so you don't have to like kill yourself trying. It's about all I can get out. So it's not like a ton. So I'm going to take my clean one and I'm going to go over the tip and then over the little tip that sticks inside that. And then in this case, I'm actually going to take my dirty one and wipe off my finger because I got a little icky stuff on there. So before you close this up, so see how, I mean, I squeezed it really well, but you're still going to have potentially like a little bit left in there. And you just get out as much as you possibly can. So that's all that's coming. So we'll just kind of do this little process again. Clean this with a clean one. Okay, so before you close this up, you cannot just put the lid back on. You have to squeeze this bowl because that is what's going to help make the suction. So you squeeze it really well. So what I kind of do is like fold it down and then sort of fold it in half. Everyone sort of has their own way of doing it, but squeeze it really well. And then you take your other hand and you can put the little tip back in. And that would be much easier to see if I had glasses. But I don't. So I've got the tip stuck in there, and so now when I let go, you can see that it's really suctioned in quite a lot, which is good because that's creating more suction for the entire tubing. So that's it, you guys. And for this one, I'm just going to move this little clip right back to my bra. We'll tell you, these little clips have come in handy, but previously I've just done like a belt. And you'll see there's a bunch of different things on the market between belts, jackets with like interior pockets, or you know, different garments with pockets. Pockets are good too. It's a good way to store them. For instance, like I've actually seen people turn their hoodie like this inside out so that this little pocket would be on the inside. So that's a good little option too. So it's just really whatever works best for you. There. All right, guys, well, I think that's it. If you have any questions, feel free to ask them in the comments down below, and I'll do my best to answer. I have had 3 breast surgeries just this year, so I've got a little experience with this stuff. So anyway, I wish you all the best on your journey, sending you lots of love, and just know that these drains stuck, but it's temporary. So hopefully you'll get yours out soon. And until next time, my friends, live your best life.